Let's compare two different routes of administration. Let's calculate an oral bioavailability, and let's also try to describe this idea of the first pass effect. Route of administration has an effect on drug exposure. The FDA recognizes over 100 different routes of administration, but we'll just discuss two: the intravenous or IV bolus and oral administration. On the screen are two CP time curves for a drug from a 20 milligram dose with the same y-axis scale. The left curve is for the drug administered by an IV bolus. All the drug immediately enters the plasma. CP starts high and then slowly tapers off. On the right is our familiar oral curve. The CP starts at 0, and as the drug is absorbed, it rises and then tapers off. Here are the AUC values for these two doses. That's microgram hours per milliliter. Note the dose is the same, but the areas are different. The oral dose gives a lower AUC, a lower exposure than the IV dose. IV administration maximizes possible exposure. All the drug is directly placed into circulation. There is no absorption phase for an IV bolus. That's not true for an oral drug. The patient receives the full oral dose, but the full dose doesn't necessarily reach the plasma. Remember, we're measuring the drug in the plasma. Not all the dose is made available to the patient. Oral bioavailability or F is not necessarily 100%. F is equal to the oral area under curve divided by the mass of the oral dose all over the area under curve for the IV dose divided by the mass of the IV dose. F is a number between 1 and 0 and is often listed as a percentage. For the drug in these curves, F is equal to 0.75 or 75%. Why isn't all the dose absorbed? There are several factors, but the most important is the first pass effect. The pill enters the GI tract, dissolves and releases the drug. The drug is then absorbed across the lining of the GI tract and enters the hepatic portal system, a special branch of the circulatory system for nutrients from the GI tract. Before entering general circulation, blood from the hepatic portal system passes through the liver. The liver, the primary site for metabolism, breaks down a fraction of the drug. The fraction of drug lost is determined by the extraction ratio of the liver. Here we have 8 particles in the GI tract, and all 8 reach the hepatic portal system. If only 6 make it into general circulation, then the oral availability, F, equals 0.75 or 75%. The extraction ratio, E, equals 1 minus F. So in this case, the extraction ratio is 0.25. There is no ideal bioavailability, but higher numbers are preferred. An oral bioavailability of less than 20% is uncommon. We've now seen two different routes of administration, IV and oral. We've talked about how drug exposure is affected by the route of administration, and we've discussed the first pass effect.